Good evening, happy Friday, and welcome to the News at 6. I'm Marian Davidson. Thanks for joining us. It has been 1 week since tragedy struck Helena area high schools and 2 students were lost to suicide. MTN's Jonathan Ambarian spoke with school officials about the impact and support that is available to students and parents.
Helena Public Schools Superintendent Rex Welts says last week, when 2 students died by suicide, it had an impact on the entire district.
When something happens at Helena or Capitol or one of our elementary, we all feel it. I mean, every teacher, although it may not be our school, it's our district.
Welts called it one of the worst weeks that we could imagine because of those 2 deaths and the death of a former student in a car crash. He said they have been focusing on providing needed support for students and for staff.
I think that's the important step of getting through a tragic event or a tragic week, is to allow ourselves the grace to mourn and grieve and heal.
Support has come from many places. That includes the district's own counselors and behavioral health teams. Shodair Children's Hospital and other private practices reached out to provide assistance.
Our resources out in the community have certainly stepped up to help out and offer, and we've taken advantage of that.
Carl Roston, the suicide prevention coordinator for the Montana Department of Public Health and Human Services, has also worked with the district. He says his focus was on helping the district plan for an organized response to suicide. He says it's essential to identify students who are at high risk and make sure they're getting the help they need.
It's critical that the school connects with them. We really want parents to be aware of warning signs to look for and to make sure that they're working with their pediatrician or a local counselor or mental health provider to provide resources or services if a child needs them.
Roston says going forward, it's important to have broader screenings of students so teens with risk factors can be identified earlier.
What we're really hoping for is to have the screening in place so that parents have the information they need to make the best decision for their child.
We have a link to some additional resources from DPHHS on our website. Also, anyone who is struggling or has a friend who is struggling can call the Montana Suicide Prevention Lifeline at 1-800-273-8255 or text MT to 741-741. That service is available 24 hours a day, 7 days a week. In Helena, Jonathan Ambarian, MTN News.